This is what I've been dying to ask you. How should a student approach parties and other social gatherings on campus?
Don't. Don't. Okay.
What we're going to talk about is how to deal with living on campus with COVID-19. And I decided to consult with an expert. Dr. Matthew Roberts is joining us today.
Hey, Danny.
And I came up with a list of questions. And what I'm going to do is I'll just hit you with these questions one at a time. All right? So for a student getting ready to leave for school, and I'm sure a lot of them are there certain medical considerations they need to address?
One of the first things that people should address is their own personal medical history. They need to be aware of that. If they have any diseases, if they're on any medicines, what dosage, how many refills they have. I have patients who come in who are in their late teens to early 20s, sometimes even in their mid-20s, whose parents call and make the visits for them. If I ask what medicines they're on, they'll say, well, I don't know, and they'll have to call their parent to find out during the visit. So if you're going to leave and you're going to go away to college, maybe mom or dad is not going to be there to help out with that. So this would be a good time to take the initiative to really educate yourself on what's going on in your own personal medical world. In terms of COVID, all right, the big thing is going to be your knowledge of your own comorbidities. Right? If you have any serious lung diseases or serious cardiac issues, for the most part, people who have those diseases, they're going to know about it. But just refresh yourself on it. Cleanliness is a very, very big thing. Let's look at college from an epidemiologic standpoint, right? It's a large group of people coming together from different locations and living in tight quarters for a prolonged period of time. And unfortunately, some of those people are going to have personal hygiene habits that are suspect, less than desirable, right?
Yeah.
So, bathe daily, all right? Clean your dorm rooms, do your laundry. Like, I went to college, all right? So, I understand. Don't let empty pizza boxes stack up 15 high in the corner of the room. Wash your hands. Wash your hands all the time. If you're about to eat, you should have just washed your hands. Wash your hands after you eat. If you're walking down the hallway and you see a bathroom, just duck in there and wash your hands real quick. Or use the hand sanitizer that's going to be on the wall in a lot of these locations. Okay. And also, don't touch your face.
So what should be in a basic first aid kit in the dorm?
That's a good question. Basic first aid kit for a dorm room should include some sort of over-the-counter painkiller. An ibuprofen, acetaminophen. Okay, you need to have some sort of topical antibiotic ointment that you can put on a cut, and then also have some sort of sterile compress that you can just apply pressure to the wound and just help stop it from bleeding. One of the things you need to keep in mind is, do you have any bleeding disorders? All right, so understand that. Something like rubbing alcohol, something just to pour on it for an antiseptic, and then a thermometer. This day and age, temperature is going to be very important. Okay. If you think you have a fever, you need to know. But just keep in mind that first aid is first aid, right? It's not the end. You still need to go and be evaluated by at least a school nurse or a medical professional just to see if there's anything else going on that needs to be taken care of.
Okay. Yeah. All right. I'll throw you off.
One of the other things you want to consider about first aid is that there's a lot of good YouTube videos out there that just educate people on the very initial basics of it. And so before you go to school, just sit down and type a few in and see what it tells you to do.
Yeah. For those college campuses that are open and for students leaving for college in the fall, what do you think students should bring with them above and beyond the normal dorm room supplies?
Cleaning supplies. Like we talked about previously, cleanliness is going to be a big thing this year.
Yeah.
You need to be able to clean your dorm room, clean your desk, clean the bathroom, clean the shower. Bring a little hand vac, something that you can just vacuum up the floor real quick. Hand sanitizer, hand soap, some sort of a face wash, something to clean your face, and then masks. definitely bring yourself a good supply of masks.
All right. Can you give us the latest update on CDC guidance with masks? I've heard there's a lot of nuance here, especially with some of the types of masks that you wear.
One of the things we need to clarify is that there's a difference between masks between just the general public and healthcare providers. So masks for the general public should not include N95s and surgical masks. Those should be reserved for healthcare workers, first-line workers. Okay. There's an excellent tutorial on the CDC website about what does constitute a good mask, and they also will show you how to make one.
Yeah.
It can be just any sort of cotton cloth, a t-shirt that you've cut up for it. Okay. But you just keep in mind that my masks protects you from me, and your mask protects me from you. It's a exhaled respiratory droplet.
Okay.
That's the issue with COVID. So if you wear a mask that has an exhaust valve in it, and you've seen those masks that have a little round exhaust valve on it, they're not doing their job. So don't wear one of those. Okay. The other issues about masks is how you wear it is just as important as wearing it. Okay. It needs to cover your whole face. It needs to fit snugly, but be comfortably. But don't pull it down below your nose. Don't wear it down here. All right. Just wear the mask. Wear it properly.
This is what I've been dying to ask you. How should a student approach parties and other social gatherings on campus?
Don't. Don't. Okay. If you've got to go, if it's a mandatory social gathering, just keep in mind the 3 W's, which is wash your hands, wear your mask, and watch your distance. Keep social distance.
What's the first thing a student should do if they start feeling symptoms?
Fevers, chills, headache, shortness of breath, nausea, vomiting, fatigue, muscle aches, runny nose. A lot of just classic flu-like symptoms. All right, could be COVID. All right, so if you have a fever or a cough and you may have COVID, most people who have this are going to have a mild illness and they'll be able to just recover at home. If you think you've got it, contact your healthcare provider. All right, don't go there. Call them up. They'll give you directions on what to do. Expect questions like, how high of a fever are you running? Are you having any chest pain, any shortness of breath? The fever thing as a physician, and particularly the ladies and the gentlemen in my office who answer the phones will tell you this, you need to be able to give a number. Don't just say, I feel warm. Right?
Okay.
Give an actual number for a fever, which goes back to that first aid kit. You need to have a thermometer.
Okay.
Right? And so if you have real serious warning signs, so that's going to be trouble breathing, chest pain, inability to stay awake, fatigue, bluish lips, they're probably going to direct you to the emergency room. But the emergency room needs to be aware that somebody with COVID-like symptoms is coming in. So call ahead, tell them what's going on, tell them that you're going to be coming, and they will have a plan in place to either meet you at the door or to direct you in another entrance. Don't just show up at the ER with COVID symptoms.
Dr. Roberts, I want to thank you for spending some time with us. So just wanted to make sure we had a professional opinion. So.
Let me interject one more thing.
Sure.
Just keep in mind that the CDC's website is great. They update it very frequently.
Okay.
It's very easy to use, very user-friendly. If you got any questions, check out the CDC website first.
I'll make sure I leave a link below. I'll leave a link below on the CDC website.